Dr. Jason Sargis, we're here. I'm honored to have you as the first guest on the Live Long and Healthy podcast.
Thank you for having me. This is, I think what you're doing with this is really great. And I think it's going to benefit a lot of people.
Well, we'll see how it comes out. Hopefully it works out well. But, so since this is the first episode, I just want to explain to everyone listening how we got here to do this. And I've been a chiropractor since 2008, personal trainer since 1999, Bachelor of Science in Exercise Science. And I feel like, and we've both been practicing since about 2008. I feel like about maybe 8 to 10 people or 9 to 10 people that call in or come in for any kind of treatment are kind of misinformed or ill-informed about how to best take care of their health and wellness. So I think something like this, and the way I met you, to tell everyone, is I came in and I was your patient for acupuncture. And we had some brilliant conversations about, just how to, best way to get rid of people's pain and reduce spasms, all that. So I figured this would be a great conversation for the general public to hear. So I'm honored you're here. And so you've been an acupuncturist since 2008, doctor of acupuncture. You want to tell us a little bit about yourself?
Yeah, sure. I grew up in Paterson, New Jersey. Went to school, did my undergraduate, University of Chicago. My bachelor's was in biology. And then I ended up going to acupuncture school. Yeah. So acupuncture school is kind of broken up into master's programs and then doctoral programs. Yeah. So my master's program was 4 years. And then my doctoral program was an additional 2 years. So that ended up being 6 years after my bachelor's degree. Nice. And and I didn't learn until today. So not all acupuncturists are doctors, basically. This is correct. Not every acupuncturist is required or decides to, pursue a doctorate degree. Gotcha. And what I love about you, I think I've mentioned this, I've been to a lot of acupuncturists over the years. When I first started working as a chiropractor, I started my own practice right away, but I was working per diem at other chiropractic offices around the state of New Jersey, and a lot of them had an acupuncturist, so I would get a complimentary treatment. And I felt like a lot of people were just putting pins in, where like your style, maybe similar to dry needling, and you could shed some light on this. You feel for trigger points and actually stick the pins in certain areas. And you're the first and only acupuncturist that ever started me either face down or face up, put pins in, felt for trigger points, spasms, whatever, took the pins out, and then did a second treatment, turned me over onto the other side and put a new set of pins in. And I just think it's brilliant. One question I have for you, why do you think you're the only acupuncturist that does that I've seen? Yeah, well thank you for the compliment. I think, a couple of things. One for dry needling. So we'll address that first. So, dry needling, oftentimes, physical therapists will do it, and, they'll go to school classes for maybe a couple weekends. Then now all of a sudden they can insert needles into people. Whereas acupuncturists in New Jersey, we're doing a minimum of 2,500 hours. 2,500. So that's, that just tends to be the big difference between, taking a weekend class and then, studying what, your life calling is. Yeah. And then for me, I tend to, people are coming because there's something going on, right? They're in my office and I do the best I can because they don't want to be there the whole time, right? They're like, I'm here so that I don't have to be here anymore, right? So something I always keep in mind is, there's no greater thief than the one who steals your time. So I really do focus on trying to provide the most effective and efficient treatments I can. So part of that is I go straight to the problem area. For some people, if they have neck pain, putting a needle in their neck is going to feel good. Yeah. Because you're getting to where that pain is, you're touching that pain. So that's always just kind of been my perspective on things is, where is the issue? Let's target that and then provide symptomatic relief. And also you're addressing the root cause of the issue. Yeah. Yeah. And it's interesting about what you talked about, the education for dry needling. I know a ton of physical therapists. I always go for physical therapy as soon as I have
an issue that's not going away after 2 weeks because, you know, it's not good to treat yourself. You need somebody to mobilize my joints. I feel like not a lot of PTs do dry needling from what I've come across in the area. I mean, I could be wrong. I don't think it's too common.
Sure. Yeah. So the whole origin of that is, physical therapists asked the PT board if PTs could do dry needling in New Jersey. The PT board came back and said, well, there's nothing that would prevent you from doing it. Mm-hmm. But, you know, as we both know, your practice act will clearly state what you can do.
Yeah.
Right. I mean, just because, you know, my practice act doesn't say I can't do electrical wiring in a building, doesn't mean there's permission to do that.
Gotcha.
Yeah. So then, you know, they recently, you know, passed a law. We tried to get some amendments to increase the hours, but, you know, the sponsors of the bill weren't amenable to that. So PTs in New Jersey are going to start offering dry needling after only 80 hours.
Yeah. Well, the good news is what I realize, you know, as we've both been in practice now about 13 years or so, you know, when someone is as great as you, doesn't matter. You can have an acupuncturist across the street from you, down the block. And I was the same way. Like, I didn't care if a chiropractor was across the street from me when he moved across the street after I opened up, and I didn't mind. I mean, we practice different. And so when you're really good at what you do, people are going to find you, and, you know, you're going to be busy, especially. And that's what I love about what we do. And I've been a chronic pain patient. That's why I'm real passionate about this. I grew up with low back pain. You know, when you could get rid of people's chronic pain, like, I love the person that calls me and they're like, oh, I've had this issue. I've gone here, I've gone there. Nothing's worked. I'm like, let's sit with me. I'm going to spend an hour with you and we'll figure it out, you know? Yeah. One question for you. So I guess what's the percentage? Most people come in because they have pain in a joint or certain pain. Is there
correct?
What's like example? People come in for any other things like?
Yeah, all the time. So I would say that acupuncturists tend to be the providers of last resort. You know, people, you know, they've been to their primary care specialist, you know, whichever provider, and then they come to us and say, help me, right? So yeah, I mean, we get people in lower back pain, neck pain, headaches, any sort of musculoskeletal pain. But then, you know, we also help a lot of people who are going through fertility treatments, right? So women's health and fertility is a huge part of my practice, because about 80% of most acupuncture practices, the patients are female. So it's you know, it's something that you have to know how to treat. Yeah. And then we also have people come in with internal medicine disorders, right? So for like digestive disorders, I took a class. It's called neuropuncture, and what it does is it has a focus on where we can place the acupuncture needles over major nerves. And then we use electrostimulation to neuromodulate the brain to release the different target substances that we want.
Wait, touch on that. So the pins go in close to major nerves, and then the electrical stim, how does that get?
Yeah, so, you know, we have a e-stim machine, electrical stimulator machine. Yep. It has leads that come out and it clips right onto the needle.
To the pin. Oh, okay. Yeah. I've had that done on myself. Yeah. So instead of like, say with a TENS pad, you have a large surface area that gets covered. Yeah. This is more direct application of the current because it'll go down through the needle. Deeper in. Correct. Basically right to the area. Correct. All right. Well, so I have the next question for you, but I want to back up to what you said before about how acupuncturists usually the last doctor of resort, perhaps for some people with pain, which we discussed this off camera before. I talked about alternative treatment, like that slogan, alternative treatment. And this is part of, I think, disinformation. So when someone has shoulder pain or elbow pain or back pain, you know, I guess alternative treatments acupuncture would fall under that, chiropractic, physical therapy. Well, not physical therapy, chiropractic acupuncture. I guess physical therapy in a sense that most people think they need to go to an ortho first or their primary care first physician. But I tell people and therapeutic massage as well. I say a good therapeutic massage is the first line of defense. If you have that terrible spasm, your neck is super tight, but I think it's getting better. I don't know if dogma is the right word. I think it's improving over the years, but 20 years ago, I mean, most people would think, oh, I can't go right to physical therapist. So you couldn't 20 years ago. Now you can.
Right.
Or they wouldn't think to go right to an acupuncturist. They'll go to the MD first, get an x-ray, get a prescription, definitely get a drug to take, anti-inflammatory, which is a Band-Aid, but they wouldn't start with PT or massage or acupuncture. So I just think that term alternative treatment almost needs to go by the wayside.
I agree 100%. To me, that ends up being like a remnant of like medical colonialism.
Yeah.
Right.
Interesting.
This whole idea, even with, an acupuncture, prior to 2009, we had to have a written referral or a diagnosis from a medical doctor before we could begin treatment. Right. And so you're asking someone to write a referral for for something that they don't have expertise in.
Yeah.
So how could they possibly know?
Yeah.
Right. So, I mean, so that at the end of the day, it just ends up being barriers to care. And this isn't, I'm not trashing, what some allopathic providers can do.
Yeah.
But, for things that are chronic pain, things that aren't necessarily a hospital admission. I mean, I think, we are, so, we fit into those providers that can really help.
Yeah, it's interesting. Well, it's similar. Some people will walk into my office with, and they'll want me to do their rehab or sports chiropractic care, physical therapy on them. And they'll have like, oh, the prescription says I have to come 3 times a week for 4 weeks. And I say, well, and I tell everyone, well, this is the $1 million question. What are you doing exercise and stretch wise right now on your own? And they say, nothing. Like, well, I think 3 times a week is probably going to be too much because I want to develop the habit. I want to teach you how to strengthen your core, how to stretch on your own, and develop the habit where you continue to do it at least 2 days a week, 3 days a week for the rest of your life. Because in my view, that's, besides a healthy diet, sleeping, low stress, that's what's going to keep you active and pain-free deep into your golden years, where you're able to enjoy life and you have healthy years. And so I explain to those people, I'm like, yeah, I don't think you have to do 3 times right out of the gates, like maybe once or twice, whatever is going to develop the habit where you continue with this.
Right. So it's about that lifestyle change.
Yeah.
Right. And the things that you're going to do today will pay, you'll get those dividends in 10 years, later on in life. So I agree with you. I think a lot of what needs to be emphasized is, well, how can you have lifestyle changes, right? Because, I mean, our bodies and our lives change, throughout the years. We're not the same. I'm not the same person I was when I was 16. Yeah. So I make these different changes in my life, so so I can live a healthier life.
Lifestyle. Yeah.
Lifestyle is huge.
That's a great point. One question I have for you. So some of the best acupuncture treatments I've had, and definitely by you, and I know recently, last time I came to see you, it was for like a shoulder impingement pain here and a little bit on the inside of my elbow. And, 1 or 2 pins you would stick in and you would hit, whether you're probably going right into the spasm or trigger point, which is like a knot. And just to explain to everyone listening, a spasm essentially is, picture a muscle like a box of straws, where the box is the membrane and the straws are the fibers. So when a muscle contracts, the fibers shorten. So the straws collapse to the center. So like a knot or a spasm or a trigger point is basically it stays in the contracted state, shortened state. And that's typically what I think sends off an inflammatory response, aches and pains, if that's the right terminology. So anyway, you would stick it right in, I guess, a certain spasm, and I would get that like shock that would shoot basically distally, which is distally means further from the heart. What do you think that is, like that shock? Because it feels great. I mean, it's very intense.
Well, yeah. I mean, I think you're hitting on it. It's those shortened muscle fibers. Now you're getting them to loosen up, right? So when the needle comes in, all we're doing is we can just tap on the muscle, and that action of the needle on the muscle causes it to lengthen, elongate, and loosen up. Yeah. So that ends up being part of what you're feeling, right? And then now, if you're talking about where there may be a large nerve. Sometimes, that nerve could be aggravated by that tight muscle, and you're feeling now, there's more flow going through that nerve. Yeah.
One thing that comes up with acupuncture is the word qi. Came up in chiropractic school as well. But I had this foot injury on my 30th birthday, my left midfoot, and it was pretty bad. Like, well, it wasn't that bad, but I re-injured it a couple of times.
Mm-hmm.
So then it became pretty bad. And my friend who lives in Fort Lee from chiropractic school, my best friend Dan, he brought me to an acupuncturist in Fort Lee. Older Asian guy. So I laid on the table, and basically he put pins in both hands, arms, and my right leg and foot, even though my left foot was the issue. And I think it was a long time ago. So I think he said he was trying to channel the chi or the energy into the left foot, and it didn't do anything to help. But to me, that was like the end of, I think that's one end of acupuncture treatment that I'm not a fan of. And then of course there's your end, the best end. So I don't know, like your thoughts on that, your thoughts on that experience.
Yeah. So I think, you know how some people have their preferences for certain things. Certain acupuncturists are going to have a preference for how they treat. And then that sort of treatment style will resonate with a certain segment of the population.
Yeah.
So probably what this acupuncturist was doing is there's what's called like a mirror, like you try to mirror the body. So if something's happening, if your injury's on the left side, they'll treat the right side. You know, so I mean, you know, some people will get very, very good results with that. Yeah. So I think a lot of it depends upon, you know, what treatment style will resonate, you know, with the patient,
with the person. Yeah.
You
know, actually that coincides with chiropractic care as well, because they always talked about, you know, with chiropractors, there's some chiropractors who will manipulate, adjust kind of head to toe, so to speak, neck all the way down through the sacrum, you know, no matter kind of what's going on. And some people love that. That's not the kind of treatment for me. I like to be treated it more so in that area, more gentle type manipulation, stretch type work. And that's the kind of treatment I focus on with patients. My brother-in-law, Steve Brillo, he's been going to a chiropractor, Dr. Garner, Scott Garner in Clifton. He's been going to him for years and loves him. And that treatment works for him. And Scott's a great guy, and his practice has been booming. So, you know, I guess it's true. You know, it depends on the patient.
Yeah. And then also from my perspective, so I started practicing Kung Fu when I was 14. And so for me, it ends up being more of, well, I'm more of a direct type of person, you know? So for me, wherever the issue is for a patient, that's, you know, for sure, that's where we're going to go, you know, because even when you needle, you know, if there's say, you know, organ dysfunction, right? So we will needle over where those organs are, whether we're going for the nerve root that will supply it, or if we're trying to make the myofascial connections down through to that organ. You know, that's pretty much how I practice, because we can get a needling effect all the way through by manipulating the fascia.
Interesting. Well, so actually that's a good segue to the fascia conversation I wanted to have with you. I know I asked you this question last time I saw you, and I think I don't remember if it was the impingement on the inside of my elbow that was sending some numbness down here, or the impingement here I was having. No, it was here. Because I remember I specifically said to you, I said, so I was diagnosed with cubital tunnel syndrome via MRI about 2 years ago, and then it had come back. You know, it went away with physical therapy and it came back. And I said, so with cubital tunnel syndrome, I think I asked you what your thought was. Like, is the nerve being compressed by like being squeezed between two of the tendons there? Or do you think that the fascial system or the fascia is kind of tight over it? Because after your treatment, I remember I had like 48 hours of zero pain, completely went away, and then it improved. And I think you were saying you thought it was more so like I could be tight here and here, and the fascia gets pulled tight over the nerve, maybe compressing it that way versus being squeezed between two muscles. I guess it's a bit of a gray area anyway.
Yeah. I mean, for me, it would end up like, you know, the image I like to give is, you know, you have a table and you have a tablecloth, right? And then on both ends, you pull the tablecloth real tight. It will go adhere right to that table. So now if there is a nerve there, that nerve is now getting pressure, compression onto it.
Yeah.
So, my goal is when we're treating something like that is to kind of create that space to where the nerve can then move freely in that area.
Yeah.
Yeah. So it can just glide through. Yeah.
Yeah. You've heard of nerve flossing, nerve glides?
Correct.
Yeah.
Yeah. So
it's interesting stuff.
Yeah. So it would be, instead of moving the nerve, we're moving what's compressing the nerve.
Yeah.
So that then the nerve can move more freely.
Gotcha.
Yeah.
Yeah. Nerve glides, nerve flossing. I mean, that's something I would say probably, what do you think? 9 out of 10 people in the public don't know what that is.
I agree.
Yeah. It's not part of the old school bodybuilding workout.
It isn't.
Nerve glides.
But it's so important. I mean,
it's so important. Yeah.
Yeah.
I mean, it's almost like, I guess we could probably have multiple definitions for it, I would almost explain it to someone like it's a range of motion exercise. Like this is almost for the ulnar nerve, which was my issue. You're coming up this way. I'm going to do a little radial deviation, external rotation of my arm. And now I'm getting, as I extend my wrist as well, I'm getting that stretch all the way down across, running through the ulnar nerve. And then there's a good one for the sciatic nerve, branching into the posterior tibial nerve. It's good stuff. Let's see what else. Sorry, go ahead.
I was going to say, and also just, speaking about, how sometimes, patients don't think to go to certain providers right away. And then, we mentioned the tibial nerve. So there's something that urologists do, is where they do tibial nerve stimulation for patients that have urinary incontinence. So that's also something that we do as well, because they're basically inserting a needle at an acupuncture point, and then they're attaching electrostimulation to it. That's
really, urologists do that?
Urologists do that.
Interesting.
Yeah. So I mean, that's that's exactly what we do. Yeah.
So why are they stimulating the tibial nerve, would you say, urologists?
So my understanding is that there is a neural pathway that then goes back with a relay to the bladder to help with the incontinence.
Gotcha.
Yeah. So that was part of what I mentioned earlier with the neuropuncture, just like going over major nerves, and then you can follow the neural pathway back to the brain, and then you have electrostimulation at a certain frequency and certain duration, and you can achieve the results you want.
Interesting.
Yeah.
Maybe you could pull up on Google, maybe like fascial system or something like that, so you could get a visual. Because I wrote that down. I wanted to ask you about the fascial system, just because, in continuing education courses over the last 7 years, that seems to be, I think 25 years ago, people didn't really talk about the fascial system, right? It wasn't what I'm interested to hear how you explain it to patients. You said the tablecloth was a good analogy over a table. I just explained to patients, the skin on chicken or the skin on the turkey is like the fascia. It encases the muscular system, and it's basically one continuous, we'll say, organ or structure.
Yeah.
It's kind of like webbed together, and it encases the whole body. I remember one, so that's the superficial muscle chart. That's good. That's seeing the muscles in red and then tendons in white. No fascia there though, right? Do they really have charts of the fascial system?
I don't think they do. I mean, I took a continuing ed class that was, it was a whole body dissection class.
Yeah.
Okay. And so these bodies, they weren't preserved.
Yeah.
They were quote unquote fresh, meaning people had died and then they put their bodies into freezers. So with that, the fascia was retained. Right? Because, I've also done cadaver on preserved specimens.
Yeah.
Where sometimes it gets, the fascia just really isn't.
It's a beigey white.
Yeah. Whereas when it's not preserved, it's white.
Yeah.
And just below the skin.
When it's not preserved, it's white. Okay. Yeah.
Below skin, it looks like spider webbing, but everywhere throughout the whole body.
Yeah. You can enlarge that one picture. Sorry.
Yeah.
The one you were
being acupuncturist.
The one you had before. Yeah.
Being acupuncturist, one thing that we always have with us are needles.
Yeah.
So while we were taking this class, we actually needled into the fascia.
Yeah.
And, we would wind the needle and do other like fascial manipulation techniques. And the fascia still responded to what we were doing.
Is it like, so you could kind of lift it up off the musculature?
100%. Yeah.
Interesting.
And you can wind it and tug, and you can see where these fascial line connections happen.
Wow. Yeah, it's amazing.
Yeah. So I did that with acupuncturist out in San Diego. His name is Matt Callison.
Mm-hmm.
He has a sports medicine acupuncture certification program, which I've
San
completed.
Diego.
Yeah. And he does a lot of work on that.
Well, there was a chiropractic seminar years ago, and I remember the guy mentioned something that stuck with me. He mentioned that, I don't know if it was the evidence or the science or whatever, is pointing to where a lot of the nerve endings or the pain receptors are in the fascial system.
Mm-hmm.
You know, and I think there's a lot of validity to that, because let's say you get that really bad spasm like in your left upper trap rhomboid. You know, people will have that inflammatory response will be from like the rhomboid up the upper trap, up the neck, into the right side. And, you know, I mean, there's really no muscle that encompasses that whole area. Most people think, they'll be like, oh, it's muscular. I'm like, well, soft tissue is a better term.
Yeah,
you know,
right.
it seems to me where, I mean, do you think more of the pain receptors are coming from the fascial system versus, I mean, the trap is a big muscle, but.
Well, for me, I tend to think that, you know, like if you know, going back to the tablecloth analogy, right? Like if something is happening here,
Mm-hmm.
you could just see how it will spread out and it could pull on different areas.
Yeah.
So I think that's pretty much, that's what happens. That's how people would tend to feel, you know, oh man, I have this pain here.
Like a kink in my back. I have a kink in my back.
Why am I also feeling it over here when I turn a certain way?
Yeah.
Well, because that's what's happening. Everything's just kind of getting, you know, that it's a central pulling point, and then, you know, just radiates out from there.
Well, that's like, I lost my train of thought where I was going with that, but you know what? Let me, we'll piggyback to that, but I wanted to ask you before I forget. So you're a healthy guy in what you do, especially what do you do, wellness care, like exercise wise, or, you know, just overall wellness, well care?
Yeah. So for me, you know, I like to ride a bike outside. That's fun. That's, you know, you get to see, you know, a lot of your surroundings that you don't necessarily get to see if you're driving a car.
Yeah.
That's great. You know, I play with my kids, you know, we'll go outside, you know, practice Kung Fu.
You watch the UFC?
I've seen some of it
Here and there.
Yeah.
Yeah, it's my new favorite sport to watch.
Yeah, I think it's, yeah, I mean, it's definitely a great workout at a minimum.
So are you on, how about core strengthening, stretch wise, that kind of tied in with your Kung Fu?
Yeah, that's a lot with the Kung Fu. There's a whole regimen that I do prior to working out, which, you know, you mobilize all of the major joints. And then there's certain stretches that we do that help to make sure that you have proper form while you're going through your workout. How
long does that routine take? Like the stuff you're doing before the Kung
prior,
Fu?
I would say maybe it's about 10 minutes. And then, you know, a workout for about, you know, 30 minutes or so.
Nice.
And then cool down with like a walk.
You go somewhere for that? You said you were doing Kung Fu since you were 14?
Yeah. So right now it's my backyard. That's where, you know, just work out there.
Yeah.
Or, you know, in the house during the winter time if there's snow on the ground in the back. Yeah.
Nice.
Yeah. But I feel like it's good. It gets me outside. And, you know, it's a great workout.
Now I remember the question I forgot to ask you before. Getting back to the fascia and dissecting cadavers, from when we dissected preserved cadavers in school, it seemed to me like the muscles were, some of the, like say the muscles that go down the thigh almost looked like red leather belts, like maroon leather belts. And then the nerves, whether it was the sciatic nerve or common fibula or tibia, almost looked like a thin candle, like a thin strand of candle wax, kind of what it looked like to me. So, you know, the term sciatica, I think is more like a layman's term, sciatica, meaning it, you know, there's some type of pain starting typically in the glute and shooting down the thigh, whether it's down the back of the thigh, the side, the front, whereas radiculopathy or peripheral neuropathy would be the more medical terms of classifying. And then of course, piriformis syndrome. But I always explain to patients, I'm curious your thoughts on this. I say probably 9 out of 10 people, it's just going to be, you're going to have sciatic type pain shooting down secondary to muscle spasms or kinks in the fascia.
Sure.
It's not going to be from a herniated disc that's herniated or an extrusion. It's actually compressing on a disc. And those seem to be, those are those open and shut surgical cases, it seems, where you're having like 8, 9, 10 out of 10 pain, like 24 hours a day, all the way down the leg. And it's like unbearable. And the MRI backs it up. There's an extrusion or herniation, into the left lateral recessed canal, foraminal, left foramen. You know what I'm saying?
Yeah.
Yeah, I explained to patients that, because they'll say, "Oh, well, do you think the nerve is impinged?" And I'm like, "Well," because I think they're always thinking it's a disc,
right?
Because that goes back to like us being alternative treatment, where they think they have to. A lot of people still think, and I think this is becoming dinosaur way of thinking. They have just some pain back there. It's not a 10 out of 10. They haven't lost function of their leg, and they think they have to go to an ortho first and get an MRI before they start treatment. Yeah, and it's like, no, not really. No. The MRI is not going to fix you.
No.
And an MRI, I've learned, an MRI is not an exact science. Like, I mean, there's been, I call incidental findings, which are just findings on the MRI that do not correlate with your symptoms. So it's kind of like, I mean, you could call it a BS finding, an incidental finding. And I tell people, I'm like, you better make sure you go to a good orthopedic surgeon who's going to really put his thinking cap on. Dr. Rob Masella, local, shout out to him. He's a good one. He spends a lot of time explaining. Peter Schmaus, who I've been going to in Hackensack, Paramus, since the 90s. It's important.
Yeah, I think a lot of times patients get kind of drawn into like a linear thinking, like this is the procedure, this is how we have to do it, right? And like you said, MRIs, they just provide information. But, I mean, they did a study where they looked at imaging of the lower back in terms of the pain that people had. And there's no correlation between what they see on MRIs and the level of pain that people have. Because you could have a herniated disc and have zero pain. You can have no herniations and have tremendous pain. Yeah. Right? So, I mean, so they found that there was no correlation with that.
I think it's the same study I heard about. It's almost like they MRI'd out of 100 normal, healthy adults. There was a study where they around like 70, 72 had disc bulges, where I tell people that a disc bulge is a normal finding, essentially. Like,
it happens with age.
Yeah. 50s, 60s. And, someone will walk in and say, "Oh, I have arthritis in my shoulder," and they're 60. And I'm thinking to myself, I'm like, of course you do. We all do. It's called degenerative arthritis. And I explain that these are arthritic change. There's about 7 or 8 characteristics that fall under the umbrella of arthritic change. When you get an MRI or an X-ray, radiologist's job, so to speak, is to see positive findings and write them down.
Yeah, they're looking for everything, anything, which is their job.
Yeah, so unless you're an open and shut surgical case, sometimes the MRI freaks people out, unjustly. So I would say, listen, don't even worry about what the report says. Make sure you get to a really good orthopedic surgeon, a good specialist who's going to put their thinking cap on and correlate the findings on the MRI with and I think a lot of them won't even look at the report from the radiology lab until after. I think they, for the most part, want the disc first and want to look at them themselves, make their own judgment, Yeah,
I mean, I agree with that. I find a lot of times the specialists, they don't care about the radiologist report. They want the images themselves. Because, I mean, again, it's a different filter that they're looking through. As opposed to a radiologist, which is gonna, they're gonna pick out everything. They're gonna say this. Yeah. But I agree. Those specialists, they have a different way of interpreting MRIs. But to speak to your point, I had a patient recently. She came in, classic sciatica, originated in lower back, going down one side. We did our orthopedic testing, and she was definitely positive for that. So then, we just started treating her. Yeah. Treated her about 5 times, from like 1,000 out of 10 pain. She's down to about 4 or 5 now.
That's great. Yeah.
So, and then, her orthopedist wanted to get an MRI, but she's like, well, what's the point of doing that right now? So, I mean, again, MRI, it'll provide information. But like you said before, it's not gonna treat anything. Yeah.
Yeah. And then I think those people that are kind of, in my view, misinformed, who really wait and put off going to someone like you or me or physical therapy to get better or to start treatment. They're waiting because they think they need to go to the medical doctor or the ortho right away to get all this imaging first. And then, sometimes the longer you're sitting with an inflammatory response, it could become chronic, and you run the risk of it not going away or taking a long time to go away.
Yeah. And this gets back to, kind of like, how I think about things. There's no greater thief than the one who steals your time.
Yes, that is true.
So it all becomes, all right, so, if you're coming in and you've had this pain for 8 months, it's going to take longer to help resolve that, So, I mean, and I think you find this, as well, like when it's acute, the patients respond like that.
Yeah.
Yeah. It's just, when it becomes now a chronic thing is when it takes, all right, this is a little bit more involved, longer treatment in terms of what you're doing that day and the course of treatment.
Yeah, specifically to that point, I think the difference between tendonitis and tendinosis, because I've dealt with some of those where the issues I've had that took the longest to go away was some biceps tendonitis, which probably turned into tendinosis, and tendonitis of tenosynovitis in my wrist. And it was like the second time the pain came back, like a few months later. And then, I was younger. I didn't get it taken care of as quick as I probably should have. Next thing you know, I'm dealing with this for 6 months to a year in my left shoulder. I mean, it's just like, so I think people don't realize how delicate the body could be, and it could just go the wrong direction on you, Yeah.
And then your body gets stuck in this holding pattern, so now it's not only are we trying to treat, this thing, we now have to re-educate your body, which I think speaks to, some of the lifestyle changes, you were mentioning before. It's important. It's important. Yeah. It's a group effort to get the body back.
Yeah. Have you done any research or anything into stem cell treatment, like regenerative medicine?
So for us, that tends to be something that, some acupuncturists do that in other states where they could do acupuncture injection.
Yeah.
Some acupuncturists have had great success, being able to inject the stem cells because it falls under the canopy of natural substances. So they end up doing, like PRP injections.
Interesting.
You're doing a blood draw,
Yeah.
Yeah.
I just had the whole shebang stem cell treatment done by Dr. Kripzak, DO in Bridgewater. I think I don't know if I mentioned it too.
Yeah, you sent me some of the images from that.
I've been doing a lot of research on it just because I'm searching for the fountain of youth, and I've had so many aches and pains over the years, especially in my 30s, starting with the foot into the shoulder. I tell people though my blood pressure is an A+, and my labs are perfect. Orthopedically, although I'm much better now in my 40s. At 45 years old, way less aches and pains now, especially because my weight is down and I'm working out way more than I used to in my 30s, taking care of myself better. So, and then the diet. I don't know if you ever heard of Dr. Greger's book, How Not to Die. Mm-hmm. The MD. Yep. You heard of it? You listened to it? Or?
Mm-hmm. Oh, yeah, I've heard of it, yeah.
So I listened to the audiobook. Somebody turned me on to it. My sister-in-law actually turned me on to it. And that was a game changer for me with the diet. I was already intermittent fasting, so my weight was coming down. Still eating a lot of junk food here and there, processed foods. So his whole thing is like the WFPB diet, whole food, plant-based. And I pretty much now eat nothing but whole foods, like fruits, veggies. I make 2 smoothies a day. I have 3 meals a day. So 2 of them are smoothies, but it's vegan protein powder, mixed nuts, legumes, all that stuff. But since I started eating that way, my weight came down even more. And it's true what they say, like knock on wood. I mean, I pretty much don't have any aches or pains. It's pretty amazing. Even the sciatica issue I've been dealing with over the years has been like almost non-existent.
Yeah. I mean, I think that speaks to the power of food as medicine.
Yeah.
And, and that's something I had an introduction to just growing up because my father would garden. So, we'd always have like fresh produce. So, we'd have lettuces, we'd have tomatoes, cucumbers, anything. Like we would just grow everything, and that's something that I'm doing today in my own house. So and I'm teaching my kids how to do that as well, because I do believe, like, you are what you eat.
Absolutely.
What you put into your body becomes your body.
Yeah.
So again, putting the right things in is definitely gonna help.
2 kids?
Two girls.
How old are they now?
Right now they're 9 and 6.
9 and 6. Oh yeah. So mine are 7 and 9, and that's an uphill battle in my house. Trying to get them to eat healthy. Actually just last night for dessert, so they wanted Oreos. I told them I had Oreos, so I got some light whipped cream from Whole Foods yesterday, and I cut 2 strawberries in half, 2 grapes, and I did a little dab of whipped cream on the strawberry to get, I'm just trying, and I try to explain to them, like, your taste buds will change. You don't like it now, but your taste buds will change. I mean, I wish I ate healthier growing up, the standard American diet in the 80s, 90s. I mean, the amount of days a week I had pizza, Burger King, pasta. I mean, drinking Gatorade after Gatorade and all that stuff. Soda.
And those juice drinks.
Yeah. Terrible.
Yeah.
What were we just talking about? Food for medicine, you mentioned. So that makes me think of, I was just telling you before, I was listening to one of the Joe Rogan podcasts from last week. He had a guy on who's doing a ton of research on basically his whole life, because since his mother came down with Alzheimer's, on Alzheimer's, dementia prevention and treatment, which is a hot topic because I think the general public thinks there's really nothing you could do. And I'm only halfway through the podcast, but what he was explaining, one of the big take homes I took away from it so far is that, your diet over the years, environmental factors could play a big part on brain health. I guess there's some evidence that a lot more crosses the blood-brain barrier than they thought 20 years ago. And one thing he mentioned, I actually mentioned this to you before, he was talking about extra virgin olive oil, how it's really only oil you should be eating. And he was saying that if you have like a little bit, I don't remember if he referenced a study or what, if you have a little bit of extra virgin olive oil each day, it's about the same anti-inflammatory effects as a ibuprofen. So that's just what he said. I'm not saying it. So, but, and I got to believe there's a lot of validity to that, because I mean, it's healthy eating versus, if you're taking an ibuprofen, it's going to be a Band-Aid on your pain. And we discussed it before that I guess the side effect is it shuts something off, or it disinhibits something that protects the lining of your stomach.
Correct. So then you're vulnerable to getting ulcers.
Yeah.
Gastric ulcers. Yeah.
Yeah.
Which isn't fun.
Now, if your cardiologist has told you to take a baby aspirin a day to prevent a heart issue, I would continue that. What your cardiologists say trumps what we're saying. But generally speaking, for me at 24 years old, when I had shoulder pain and I was taking 2 Advil here, 2 Advil there, like at the end of the day, if I had to do it over again, I wouldn't have taken it.
Yeah, right.
And then I was eating ice cream and all this crap food, so all this sugar.
Right.
But then also,
sugars are pro-inflammatories.
Yeah. Processed sugar. Yeah. Is what I think, right? So all the sugar from fruit, I think is fine.
That's fine. Yeah. But like all the sweeties,
fake food, chemical food. Yeah. I mean, there was something else about that. So when he was talking about the dementia, Alzheimer's, just because it's fresh in my mind, there seems to be evidence, or he kept touching on people that become diabetic, that, when you exhaust your, with the insulin blood sugar, that could be a contributing factor to like early onset dementia, Alzheimer's. I don't remember why, but it's just another reason not to eat a ton of processed sugar, right? I mean, there's got to be a million reasons.
Good for you.
Yeah.
Yeah. I mean, once in a while, fine.
Yeah.
But
here or there,
having it as part of your diet
every day,
it's not good.
How about your diet? How do you, anything in particular you like to eat, avoid, that you found works for you? Less aches and pains?
Yeah. I mean, for me, it's the processed sugars. I mean, really that ends up being, the big thing. you know, because again, you know, it's a pro-inflammatory. So if, you know, you have any inflammation that may occur on a low level in your body, it's like, you know, adding gasoline to a fire. So avoiding that it doesn't mean I'm depriving myself of it. You know, if there's a birthday party, yeah, I'll have cake.
Yeah.
You know, but it's not like, oh, let me have cake every day. Yeah.
So it's interesting because I'm unsure of this as well, and most people probably are. You know, you always heard, and I started hearing about this back in chiropractic school, but I didn't really understand what it was. I guess you'd hear about an anti-inflammatory diet or like, you know, inflammatory syndrome, I think was touched on, you know, and a lot of people are like, well, what's that? I think a lot of people just don't know what that is really. I guess someone that's really overweight, obese, swollen, you know, kind of just looks inflamed, like their whole body, maybe drank too much. So what do you think when you say the sugars are pro-inflammatory? Do you know any like the biology or the chemistry or physiology? Like what in the body, like what does the sugar do in the body that, you know what I'm saying? It must release cortisol. I don't know.
Yeah.
Cortisol is a stress hormone.
Yeah. I think it just causes the body to bring more mediators of inflammation out to an area, you know,
more inflammatory mediators.
Yeah.
I have to get a dietitian in here as a guest. So that's a good topic to dive into because people, I mean, you know, getting people away from eating that stuff is like, it's like pulling teeth.
It's tough.
I mean,
again, but this is, you know, these are these tough lifestyle changes. But, you know, if patients do adopt them, they tend to do very well, right? Because it's not only something that we have to deal with in the clinic.
Yeah.
It's also the patient has to do this at home, right? It's a two-way street.
Yep.
Yeah.
I have a long-term client who I've worked with first thing in the morning for like 10 years. And she always said that when she would get off the sugars, she would feel better. And I never got off sugars. I think kind of growing up, ice cream, cookies, and donuts with milk and chocolate chip muffins is part of my DNA growing up. So I was just like, I thought it was like far-fetched. I was like, I don't think that has anything to do with it. And then since I went that way, like it's legit. Like it's surprised me. You know, it's one of those.
Isn't it amazing?
I'm one of those pessimistic people where I have to feel something to believe in it. You know, it's really amazing. Like, I mean, for me, I'm doing push-ups again. I'm doing pull-ups again. I hadn't done a pull-up or a push-up in like, well, I had some wrist issues really in like about 8 years, you know? So fast forward to 45 now, I'm doing that stuff. Jogging again too.
Yeah.
Crazy.
Yeah.
And dropping the weight, I think, helps too. But
I mean that helps with a lot of things, especially, you know, anything from the waist down, right? Because from the waist down, it's all weight bearing. So if you're bearing less weight, you're gonna feel better.
Yep. How about so an anti-inflammatory diet would just be basically no processed sugars, whole food, plant-based, as far as you're concerned, eggs, lean meat, chicken, fish.
Yeah.
Something else Dr. Greger mentioned in his book, you always hear about antioxidants and vitamins, right? And supplements. And I don't know, it's just one of those things. I take I don't go crazy with vitamin supplements. At least I've had my phases growing up where I would take more. But again, there was never a palpable difference in how I felt really until I started eating whole food, plant-based and dropping all this weight and working out more. So I would just take a multivitamin and a vitamin C. And now, of course, since COVID came around, I take a vitamin D every day and I take a half a zinc because they always said that was good. But Dr. Greger started talking about antioxidants and he's like, you know, oxidation, when you open a banana and leave it out on the counter, or you open an avocado, leave it out on the counter, or the next day, it's turning black.
Right.
So it's oxidizing.
Right.
Which is aging. So now I'm trying to be as young as possible. So, and he started talking about green tea and hibiscus tea and black tea, how this is chock full of antioxidants. And now I'm a tea drinker all of a sudden.
Yeah.
I have 2 a day.
Tea is great.
And to me, when you say antioxidant, correct me if I'm wrong, I think it's synonymous with anti-aging, essentially. You know, if you're preventing yourself, if you're going to, lessen free radicals or...
Yeah, I mean, you're helping to prevent destruction of your cells in your body. Yeah. I mean, so yeah, I mean, I agree. Like, I think green tea, black tea, like you said, that's great. clearly vitamin C, vitamin D, those are important. And I also think sometimes, B12 is good too. I think sometimes people probably, maybe there's some inflammatory process happening in their body, or maybe there's absorption issues. But I tend to think probably people, they may be a little bit low on the B12
on the B12
side. Yeah.
Would that be B complex or just separate B12?
I think it's just like a separate B12 that you could take. Sublingual is the best.
I have to look up what foods are rich in B12. Think you could pull up on Google B12 foods with B12? Be interested to see if I'm incorporating any of that stuff.
Like chicken and other.
Yeah.
That's going to have it in there. But I just think some people, for some reason, aren't absorbing it well. Yeah. So then a sublingual would be a good supplement to take. Absorbing it well.
Well, that's an interesting segue, because Dr. Greger mentioned how he kind of poo-poos the, he talks about the vitamin supplement industry, how, it's kind of like big pharma where, there's a lot of nonsense. So, he just said that most of these vitamin supplements are not made to take on its own. Like he wasn't a fan of fish oil capsules, which I would take them here and there, but I never, so I think, I'm adding like, ground flax, ground chia, all that kind of stuff, into my smoothies, for omegas and, the multivitamin and all the fruits and vegetables. Or I think he might have referenced vitamin E. He's like, even reference where some people could become toxic in certain things because they're taking these supplements, and it's not natural. It should be in whole food, plant-based. Yeah.
Yeah. And again, it's food is medicine.
Or getting back to the word absorption, his big thing is your body's not made to absorb the pill, so to speak. Right. But when it comes in a whole food, yes, that it is. So.
Right. It's like, you're getting, say, like B12, or you're getting B12 through the food that you consume, right? The body will do better in the food, through the food that you consume. As opposed to just a straight up. But I do think, in terms of people, if there are some absorption issues, sublingual B12 is a very good option.
When you say sublingual, that means underneath the tongue. Underneath the tongue.
Yep.
Versus a capsule.
Correct.
So B12 you'll find in 3-ounce servings of these food: cooked clams, mussels, mackerel, king crab, rainbow trout, salmon. I love salmon now. I used to not like it, but red meat includes. Interesting. So if you're a vegetarian or vegan, do you think vegetarian or vegans could be deficient? I guess it's possible.
Yeah.
Getting back to the dietitian question.
Yeah, exactly. This is where I think the sublingual would be a big benefit for him.
Yeah. Oh, good point. Yeah. Something like that would be a reason to supplement. Well, Greger got into how, there's just a lot of, you can't trust all these studies that these corporations are putting out because they're funding the studies.
Sure. There's a bias there.
At the end of it, and there's just no money to be made off of going and buying avocados, apples, and eating them versus. True.
Well, they have a product that they want, that they're looking to sell.
Yeah. Interesting. Any other questions for me? I think this has been good, very helpful.
Yeah, I think this is great. Yeah, this was a lot of fun.
Smoother. We'll have to do this again.
Yeah.
We'll set up an acupuncture table next time.
Yeah, we'll do that. Yeah, we give a treatment.
All right. So we're good?
Yeah, I think I'm good. Yeah.
Thanks for joining. This is great.
Thank you so much for having me.
We'll talk soon. Next time I have a chronic issue, I'll be there. I'll be calling you up.
Yeah, sure. You'll call me when it's acute, right?
Yes. As soon as it starts.
Yeah.
All right.
Perfect.
Thank you.
All right. Thank you so much.